Good afternoon. Welcome to the Disease Network. I'm Dr. Mariana Hurtado. Today I'm joined by
Dr. Brianna Branch
and Dr. Reed Hederman.
Today we will be discussing the disease of tuberculosis.
Mariana, what is the common name of the pathogen and the scientific name that causes tuberculosis?
The pathogen would be Mycobacterium tuberculosis, and so the common name is tuberculosis or TB.
Why don't we explain the life cycle?
Okay, so stage 1 is when the bacteria is inhaled through the air. It's able to reproduce and initiate the infection. Stage 2 is symbiosis, which can last for 7 to 21 days, and during that stage it will reproduce if it's not killed or treated. Stage 3 is the initial caseous necrosis. This is when it begins to develop, and this is because of decreasing rate of binary fission.
So then, the bacteria will kill the non-activated macrophages around it and run out of cells to divide in. This bacteria then produces anoxic conditions and pH levels decrease. Stage 4 is interplay of tissue damaging and macrophage activating immune response. Mycobacterium tuberculosis uses an inactive macrophage surrounding the tubercle to reproduce, which causes the tubercle to grow. The tubercle then spreads to the lungs.
If spread into the bloodstream, the patient can develop tuberculosis outside of the lung. Stage 5 is liquefaction and cavity formation. The tuber cells will liquefy at some point. This causes the disease to spread faster.
Whoa. Dr. Branch, what is the natural habitat of the Mycobacterium tuberculosis?
So the bacteria is found in soil, bogs, surface water, groundwater, and seawater. So these bacteria can be found in many places because of their structure. Dr. Reed, why don't you tell us about the physical structure of the bacteria?
So the physical structure of tuberculosis is fairly large. They're non-motile, acid-fast, and they're about 2 to 4 arm in length.
So Dr. Hederman, how does the initial infection occur?
So the bacteria that causes TB or tuberculosis is spread through the air from person to person. When a person with TB disease coughs, speaks, or sings, people nearby may breathe in these bacteria and become infected. It also spreads, much like the cold or flu, through the expelled airborne droplets from a person with the infectious TB.
So, who's most likely to develop the disease? So it's mostly just foreign-born people, as well as people working in homeless shelters and people who do drugs.
What are the areas of the world that it's most commonly found in?
It's most commonly found in Asian countries, and here's a picture of where you can find that.
Dr. Mariana, what are some statistics of people with TB?
1/4 of the world's population is infected with TB. In 2017, 10 million people around the world became sick with it, and there were 1.3 million TB-related deaths worldwide.
Dr. Branch, can you list or provide some symptoms of active TB?
Yes. Some symptoms are coughing out blood, chest pain or breathing and coughing pain, unintentional weight loss, fatigue, fever, night sweats, chills, and loss of appetite.
So, Dr. Branch, what cells get infected from this disease?
Well, the neurons act as host cells, so
They're targeted.
yeah. So, Dr. Mariana, exactly how does the pathogen cause symptoms of this disease?
Well, when the pathogen enters the body, it goes through binary fission, and it spreads throughout the bloodstream, and basically attaches to the lungs, which can cause respiratory failure.
Yeah.
Yes.
So, Dr. Mariana, how does cell damage and death occur?
Cell damage is when the bacteria escapes a white blood cell, which the white blood cell is trying to fight it and kill it, and it's ingested and is sitting inside of the blood cell, which then it becomes latent, and then they burst out of the cell and get into other blood cells that surround it and form a granuloma. The TB bacteria then stays in there and becomes dormant, but if it escapes, it can spread infection throughout the body, and then death occurs with many types of TB, but the main cause is respiratory failure.
Dr. Hederman, what are tissue damages and organ damages that occur with TB? With TB, infection inside the body destroys lung tissue. The main bacterium that causes destroying of tissue is Mycobacterium tuberculosis. And with organ damage, the MMP1 enzyme destroys lungs, usually strikes lungs first, but a hole can develop in lungs, causing bacteria to spread to other organs in the body, such as lymph nodes, sexual organs, intestines, liver, and skin.
Dr. Branch, how does organ failure occur?
Organ failure occurs in tuberculosis for different reasons, such as the liver and renal failure due to drug reactions and heart and brain membranes from the bloodstream.
Mariana, can you discuss the way or how easy or difficult the pathogen can be spread person to person?
It's actually very easy because since it's like the flu, just common air droplets from people talking, speaking, breathing can pass the disease on. The risk for active TB is estimated at about 10%. It is a rare disease, it is contagious, but it's not ease. It doesn't normally spread casually, but it can be spread easily under certain circumstances. Mrs. Branch, what is some treatment for people with it? How are they diagnosed?
There's a specific test called the TB scan or TST test. It's also known as PUD, purified protein derivative. It determines if someone has an immune response to the bacteria that causes TB. Whenever the doctors inject the medicine, they see if you have a skin reaction with a large bump, and that determines if you have TB or not. Another test that is involved with diagnosing this disease is a chest x-ray and a sample of sputum. So, Dr. Hederman, can you tell us about a treatment available for TB?
So one specific treatment is INH, which is the most common treatment for the latent TB. It is a pill that is taken daily for 9 months, and a doctor will prescribe it to the patient.
So how well does the treatment work, Dr. Branch?
INH works very well, but sometimes vaccines for tuberculosis can intervene with that, and it has a few side effects. It can cause numbness and legs and arm pain.
What is the long-term prognosis? How long does it last? Is it curable or not?
It is curable, but it takes a very long time. The INH treatment takes several months to eventually work itself out, but tuberculosis in the end is curable.
So, hope you learned a lot about tuberculosis on the Disease Network. That's it for today. Here's the credits. Bye.